about?
Well, Dr Jerryl Banait is an executive board member of the United Residents and Doctors Association of India. He joins us from the city of Nagpur in Maharashtra. And Dr Banait, your experience, are you also seeing, trying to cope with the health service really struggling with COVID?
Yes, the entire healthcare system is overwhelmed by the sheer number of patients that are coming in the hospitals. Some of them are critically ill, some of them have severe symptoms, some of them have mild symptoms. But just the sheer number of patients which are coming in the hospital is huge. And the healthcare system is currently working at its peak. But there are three pillars in our country which are working together and united. One is the healthcare system, second is the government, and third is the participation of citizens to fight this coronavirus. Right now, it is...
Sorry, do go on.
Right now, the situation is very grim. It is dark times, not just in India, but across the globe and everywhere in the country. The second wave which has come to India has come a little later than it came in other parts of the world. But the second wave which has pushed us is really keeping us on our tippy toes, and all the doctors and all the healthcare system is working day in and day out to attend to as many patients, as many people who are coming in the hospital and giving them the best medical facility that is there possible. And every patient is being given the best of the best treatment that there is possible in these times. At the same time, we are managing with the sheer numbers who are coming in. And the government is also...
Can I pick up on you, as you were saying, there's the health system trying to give its best all the time, what the government is doing. You also talked about citizens, and I suppose that's where measures like social distancing come in, because even though there are rules, I think, in most states now limiting social gathering, there doesn't seem much evidence of that taking place.
There is a lockdown happening in certain cities and certain parts of the country. See, entire city or the entire country cannot go in a lockdown like it was imposed last year. But the local municipal corporations and the local government bodies are putting in stricter restrictions in parts of the country where it is really required. At the same time, philanthropists and the hoteliers are coming in and giving their hotels for converting them into COVID care centers, and we are increasing the beds as we speak. So every major cities have now COVID care centers where the asymptomatic patients or mild symptomatic patients are being attended to, so that the hospitals and the institutions can take care of the severely ill patients.
And can I ask you just a final thought about the vaccination program? Because I understand the intention is to offer the vaccine to all over 18s from next month. Are you confident there's going to be enough vaccine supply?
There is going to be enough vaccine supply, and I'm very thankful that the vaccination drive started at a very correct time, and that is why we are not seeing a burst in the corona situation right now. It has stalled the process of the outburst, and the vaccination drive, it has already covered 124 million citizens of India. And India is striving hard to survive this second wave, and hopefully India will come out of this dark situation and the dark times really soon.
Dr Banait, thank you very much for spending some time with us today on BBC World.